वेलकम टू RRB NEXUS। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सेट, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। जॉइन अस रेगुलरली टू मेक श्योर योर सिलेक्शन।
In which condition is a distal pulse preferred rather than an apical pulse? A. Arrhythmia. B. Shock. C. Hypertension. D. Heart block.
And the answer is option B, shock. Shock is a life-threatening condition in which there is inadequate blood flow to the organs and tissues. During shock, the body's compensatory mechanisms cause vasoconstriction, which can make peripheral pulses, distal pulses, difficult to feel. In such cases, it is more reliable to assess the central pulse, such as the carotid or femoral pulse, rather than relying solely on distal pulses. Arrhythmia, apical pulse, is preferred as it allows accurate assessment of irregularities in the heartbeat. Shock, distal pulses may be difficult to feel due to vasoconstriction, so central pulses, such as carotid or femoral pulses, are preferred for assessment. Hypertension, no specific preference for distal pulse in evaluating high blood pressure. Heart block, apical pulse, is essential for assessing heart rhythm and identifying abnormalities.
Which of the following theorists proposed the self-care deficit theory? A. Dorothea Orme. B. Martha Rogers. C. Betty Newman. D. The Madeline Leininger.
The answer is option A, Dorothea Orme, because she is the theorist who proposed the self-care deficit theory. Here are some points explaining why. Dorothea Orme proposed the self-care deficit theory. The theory focuses on individuals' ability and responsibility to take care of themselves. Self-care activities, such as hygiene and nutrition, are essential for optimal health. When individuals are unable to meet their self-care needs, nursing interventions are required. Nurses assess self-care deficits and provide appropriate support and interventions. The theory emphasizes the importance of self-care in promoting health and well-being.
Which of the following is not a crystalloid solution? A. Normal saline. B. Ringer lactate. C. 5% dextrose. D. HES.
And the answer is option D, HES. First we have to know about crystalloid solution. Aqueous solution with small molecules and electrolytes. Can freely cross cell membranes. Used for fluid resuscitation and electrolyte replacement. Colloid solution. Contains larger molecules or particles. Stays in intravascular space longer. Used for volume expansion and maintaining blood pressure in severe hypovolemia or shock. Normal saline, crystalloid solution containing sodium chloride dissolved in water, used for fluid replacement and electrolyte balance. Ringer lactate, crystalloid solution with sodium chloride, potassium chloride, calcium chloride, and sodium lactate in water. Used for fluid resuscitation and electrolyte correction. 5% dextrose, crystalloid solution with dextrose, sugar, dissolved in water, used for energy and fluid replacement. HES, hydroxyethyl starch, not a crystalloid solution, but a colloid solution. Contains modified starch molecules to expand plasma volume.
Which of the following blood types is considered the universal blood donor? A. Type O. B. Type AB. C. Type A. D. Type B.
And the answer is option A, type O. The existence of different blood types is due to the presence or absence of certain molecules called antigens on the surface of red blood cells. The ABO system classifies blood into four main types, A, B, AB, and O, based on the presence or absence of antigens A and B. Type O blood is considered the universal donor because it lacks both antigen A and antigen B, making it safe to transfuse to individuals with any blood type. Individuals with type AB blood are considered universal receivers because they have both antigen A and antigen B on their red blood cells, allowing them to accept transfusions of any blood type. Therefore, the answer to the question is option A, type O, as it is the universal blood donor due to the absence of both antigen A and antigen B on its red blood cells. It is important to note that while type O is generally considered the universal donor and type AB the universal receiver, there are still other factors to consider in blood compatibility, such as the Rh factor. For example, an individual with type O negative, O, blood is considered the universal red cell donor for all blood types, including Rh positive and Rh negative individuals.
And for additional queries, search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.